The role of public health isn't always easily understood. Climate change is very much seen as an environmental issue or an economic issue, but climate change has serious impacts to human health. Well, we're definitely seeing more extreme heat days, and that's going to continue. We're seeing less frost days. Last summer we saw poor air quality as a result of the forest fires. So when you're looking at people who already have respiratory issues, chronic diseases, people who work outdoors may also be more exposed to things like vector-borne disease from ticks or West Nile virus. And so we need to look for ways to support them with programs, services, policies that protect them from the impacts of climate change moving forward.
And this is a very big issue. You as an individual, what can you do? And it may sound silly, but even the simplest thing like building social connection, making sure when there's a heat wave that you knock on your neighbor's door if you know they're elderly and live on their own, and you make sure they're okay. So if we have snowfall or ice storms, things like that, to get out and help your neighbors clear their ice. Human beings can do amazing things if they choose to.
We have to learn how to work in unison with Mother Nature, right? And try to have that least amount of environmental impact that we can. I'm a 6th-generation farmer here in Oxford County. We're still a family-ran operation. I work with my dad, and I'm hoping that my children will take over the operation at some point. A few years ago there, we got into renewable energy through the FIT program, through the Ontario government. We're producing green electricity there through our anaerobic digesters on the farm.
When Southwestern Public Health was asked to do a vulnerability assessment to climate change, quite rightly, they came to the Climate Institute at the University of Waterloo to ask for help and support. And we had such a strong and consistent message from Southwestern Public Health, both inside the health unit and outside the health unit, that they were very, very committed to equity. They wanted to make sure that if there were populations made vulnerable by structural circumstances, that they wanted to focus on them first, and that they also wanted to focus on action.
Southwestern Public Health can work with community agencies and partners to ensure that our communities are set up and designed to protect those populations that are going to be most vulnerable to climate change impacts.
So the whole thing is, how do we get human beings to choose this instead of something else? And I think two things. One is coming together in collective, and the other is knowing that you can make a difference, so empowering that. We have that power.